Guided biofilm therapy is a comprehensive, personalized approach to teeth cleaning, where it really focuses on removing the biofilm, which is basically the cause of most dental diseases like caries or cavities, gum disease, and gingivitis. Traditional cleanings can't really remove all the biofilm. So doing this through an airflow technology allows us to remove every speck of it. And the guided part is where we really disclose it. So we're visually seeing where the biofilm is and using this airflow technology to remove it completely, not just on the teeth, but on all surfaces in your mouth, which is your palate, your gums. So you're really not just getting a teeth cleaning anymore, you're getting a mouth cleaning. Well, forget about the gritty paste and rubber cup. I mean, I've been doing that honestly for the last 30 years. And once we switch over to the airflow technology, it's been a game changer. It's so microly fine, but it uses a light powder and warm water together to really sweep through every part of your mouth in a very comfortable manner. So I can't imagine going back to the traditional cleaning, and neither can our patients, because it's so comfortable, but it's so effective. And visually, once we remove everything, patients can feel the difference, and it actually makes your teeth stay cleaner longer, well after the appointment. Biofilm is really the source of all initial infections. So you have biofilm that's been sitting there and it's not being thoroughly cleaned off through traditional teeth cleaning. If there's an infection in your mouth, guarantee it's traveling throughout your body. So if you're removing that biofilm as much or all of it as you can through every type of cleaning that you come here in our office, it really allows that infection to cease. And if you don't have infection, then you're on your way to overall health. And that's really the key to guided biofilm therapy. Well, guided biofilm therapy is really, like I said, based on an airflow technology. And then the tips and the instrumentation that we use really allows our airflow to really go beyond up to 9 millimeters below the gum line. That is really almost impossible with traditional scalers and rubber cut paste. So this type of technology allows us to really be able to get to an area that we've never been able to get to before. So if you're not able to get to it, that area is just not getting cleaned or cleaned thoroughly at all. So it's really incredible to have this technology in our office that we use exclusively for all our patients. And it's been an incredible change, and patients have felt that, again, more comfortable, but also better effects, and the health benefits are amazing, because if you don't have chronic infection going through based on this biofilm, then you're in better shape overall. Even my 8-year-old, when we first cleaned on him, he said he literally put his hands back in the head and he goes, "I could do this all day." So it's incredible. From an 8-year-old to a 98-year-old, we've had patients that have different various issues in the past with traditional cleanings, whether it be, sensitivity, the noise, or anything like that. All this goes away with guided biofilm therapy through the airflow technology, because of the airflow and the warm water, and even down to the scaler that is used. Even the noise factor is almost down to none. So it's been an incredible change in our practice, and we can't imagine doing it any other way. Guided biofilm therapy through the airflow technology allows us to use warm, customized water, meaning that traditionally in the past, if we were to use water from traditional instruments like a Cavitron or any kind of water, it's usually pretty cold, and most people are super sensitive. And sometimes that's why they let, kind of honestly not stop going to the dentist regularly, because it's just fearful that it's going to be uncomfortable. With this technology, it's a water contained, and it's also customizable. I can make it warm, warmer, or even warmest, and it just allows the patient to really be comfortable, because most of our patients with ultra sensitivity does not really have any issues with the airflow, and we just love it, because quite honestly, I'm a sensitive patient myself. I can't imagine going any other way than using this type of technology to get my teeth clean moving forward either. We wanted to use the best technology out there. And quite honestly, I'm all about facts and science. I've been secretly stalking this technology for quite some time before I made the investment to say, hey, you know what, we should move forward with this technology, because this is the very best. We never want to give our patients technology that is not backed by science. And that's why we feel so strongly that with this guided biofilm therapy, that we're not only using the best science, but we're using something that is so beneficial and helpful for our patient and comfortable. And when their patient is comfortable and they're healthier and they're happier, they're going to continue to be able to invest more in their health and their overall health. So that's kind of why we invested in this technology, because we want patients to feel comfortable going to the dentist and feel like this is a pleasant experience and not something that I dread. And so finding a technology like this that only helps the patient feel better, but you also get that experience where you're giving them a better experience overall. one of the first steps of guided biofilm therapy is to reveal or disclose where the biofilm is prior to us getting started with the cleaning. So we're able to take a photograph and be able to show the patient how they're doing before we get started. So again, more on that education, because once the patient is kind of on board or co-owning their situation, it allows them to really immerse in their home care. So when we take that picture and it shows them areas that they're missing or areas that they need to maybe focus on more, and then we go about cleaning that biofilm off, then we share that image with them via text so that they can be able to go home and use that as a roadmap for themselves to be, oh, look, I'm missing this area, or this area I was consistently missing. So they're able to visually see where the biofilm is so that they're able to help themselves take better care of their home care. So we find that it's amazing. That first step of disclosing, revealing that biofilm, quite honestly, with traditional cleanings, you don't really do that. But with this, it's part of the protocol, and we encourage our patients to look at that picture and be able to use that to improve their home care.